What is seropositive Ra and how does it damage joints? Imagine your body's immune system as a vigilant defender, but in rheumatoid arthritis, it mistakenly targets your own joints. When we talk about seropositive rheumatoid arthritis, or seropositive Ra, we're referring to a form of this condition where specific antibodies are found in the blood. These antibodies are rheumatoid factor and anticyclic citrullinated peptide antibodies. Not everyone with rheumatoid arthritis has these, but when they are present, it's called seropositive Ra. About 60 to 80% of people with rheumatoid arthritis are seropositive, making it the more common type. Rheumatoid arthritis is an autoimmune disease, which means the immune system gets confused and attacks the body's own tissues. In seropositive Ra, the presence of these antibodies signals a more aggressive immune response against the joints. These antibodies can be detected in the blood even years before any joint symptoms show up. However, having a positive blood test alone doesn't confirm the diagnosis. Doctors also look at symptoms, physical exams, imaging tests, and other factors to make a full diagnosis. Now, how does seropositive Ra actually damage the joints? It all starts with the immune system targeting the synovium, which is the thin lining inside the joints. This triggers inflammation, causing the synovium to swell and produce excess fluid. Over time, this persistent inflammation damages the cartilage, which is the smooth tissue covering the ends of bones that helps joints move smoothly. The inflammation also erodes the bone itself. As the disease progresses, joints can become misshapen, lose their normal structure, and function poorly. This tends to be more severe in seropositive Ra compared to seronegative forms, often leading to deformities and disability. The typical progression begins with swelling, pain, and stiffness, especially in small joints like those in the hands and feet. Morning stiffness lasting more than 45 minutes is common. As cartilage and bone break down, joints may become unstable, and lumps called rheumatoid nodules can develop under the skin near affected joints. X-ray images often reveal these changes, helping doctors track how the disease is advancing. Seropositive Ra doesn't just affect the joints. It can cause systemic symptoms like fatigue, low-grade fever, weight loss, and anemia. It's also linked to complications outside the joints, such as inflammation of the eyes, dry eyes and mouth, rheumatoid nodules, and, in rare cases, inflammation of blood vessels called rheumatoid vasculitis. Research shows that seropositive Ra tends to be more aggressive. The antibodies in the blood aren't just markers. They actively contribute to inflammation, speeding up joint damage. That's why people with seropositive Ra often experience faster disease progression, more joint deformity, and higher chances of complications outside the joints compared to those with seronegative Ra. Diagnosing seropositive Ra involves blood tests for rheumatoid factor and anti-CCP antibodies, along with symptom assessment, physical exams, and imaging like X-rays or ultrasounds. Early diagnosis is crucial because starting treatment early can slow or even prevent joint damage. Regular monitoring with blood tests and imaging helps doctors adjust treatments to keep the disease under control. While there is no cure for seropositive Ra, modern treatments can effectively manage symptoms and slow joint damage. These include disease-modifying antirheumatic drugs, biologic therapies, and corticosteroids. Physical therapy, lifestyle changes, and supportive care also play important roles in maintaining mobility and quality of life. Understanding whether Ra is seropositive helps doctors predict how the disease may progress and choose the best treatment plan. It highlights the importance of regular follow-up and monitoring for both joint health and overall well-being. If you or someone you know has rheumatoid arthritis, working closely with healthcare professionals is key to managing symptoms, preventing disability, and addressing any concerns about treatment options. Always seek personalized advice from your doctor, as each case can be quite different.